Hello guys, hello. I hope you guys are doing great. I hope everyone is feeling good. It's quite cold this week around the country. There are areas that have got snow, but because of the riot that is happening in the country, so the news people, the media people, they are focusing on the riot, but there's like snow in parts of the country. It's quite cold, guys. That's why I have my hat on as well. So I hope you guys are keeping warm, are safe, wherever you are speaking from, wherever you are. Okay, so guys, let us continue with our psychotic disorders. I said we're gonna do them one by one so that we can all of us understand them. So today's remember, we have covered brief psychotic disorder, we have covered schizophrenia. So today we are covering schizophrenia. And remember what we said. We said that so this is schizophrenia. We said that psychotic disorders, they are called, or they are put under the psychotic disorder umbrella because they share similar signs and symptoms. And we said that these are the symptoms which they share. So each and every condition that is under the psychotic disorders should have these symptoms. We said delusions, we said hallucinations, we said disorganized speech, we said disorganized behavior, including catatonia. So those are the 4 symptom domains, right? Those are the 4 symptom domains. I've met students and I will try to explain this, and I don't know why, but they seem to not to understand when I talk about the domains. These are the 4 domains that you find in psychotic disorders. If you can look at this, we know that delusions, this is a thought content disorder. Hallucinations, perception disorder. And then this is speech, this is behavior, including catatonia. So these are the 4 symptom domains. So, and we said that most of these conditions, you find that there's more than one symptom from these domains. And then we've got conditions whereby you only have the symptom that is there is only from one domain. Like I made an example of delusional disorder where you only have delusions only, you don't have any other thing. And I also spoke about the catatonic disorder where you only have a behavioral abnormality. There are things you don't have. Okay, so these are the 4 symptom domains, guys. These are the 4 symptom domains. 4 symptom domains of psychotic disorders. We did say that all of these psychotic disorders, they've got these features, 1 or 2, but they should have. If you've got a patient who presents to psychiatry but they don't have any of these symptoms, then that symptom is not psychotic, because by definition they should have one or more of these, depending what condition do they have. Do they have a brief psychotic disorder? Do they have a schizophrenia form? Do they have schizophrenia? Do they have psychosis due to substance or medication or another medical condition? Depending, but they should have one or more of these symptoms. Okay, so now when it comes to, there's a difference now when it comes to schizophrenia. For schizophrenia, they've added a fifth domain for schizophrenia. We have not spoken about negative symptoms. We have not spoken about negative symptoms when we spoke about brief psychotic disorder, and also when we spoke about schizophrenia form. So this is the first time we're talking about negative symptoms. So which means now for schizophrenia we've got 5 symptom domains, which is now the 5th one is negative symptoms. So guys, let's talk about schizophrenia now. Schizophrenia, like brief psychotic disorder, there are criteria. There's criterion A, B, C, D. Criterion A, this is a criteria that needs to be met in order for us to say this patient has got a schizophrenia. So the first, so criterion A says that for us to be in the path of diagnosing schizophrenia, our patient should have 2 or more of these symptoms. 2 or more of these symptoms, right? 2 or more of those symptoms. And like we've been saying, that in brief psychotic disorder you needed, I think we needed 1 symptom, or you needed 2. Please guys, go back and check. I'm forgetting the numbers now, but go back and check. Go back and check how many symptoms do you need for brief psychotic disorder. How many symptoms do you need for like the minimum symptoms that you need? How many how many symptoms do you need for brief psychotic disorder? How many symptoms do you need for schizophrenia form? How many do you need for schizophrenia? For schizophrenia, you need 2 or more of these symptoms. Okay? I explained this thing in other videos where we spoke about schizophrenia form, we spoke about brief psychotic disorder. So for schizophrenia, you need 2 or more of these symptoms. 2 or more of these symptoms, and 1 of these symptoms should either be 1, 2, or 3. So if you have got a patient who has got delusions and hallucinations, we are good. We've got 2 symptoms. That's the minimum we need, and on top of that, those 2 symptoms are from either 1 or 2. Also, if you've got 1 and 3, still good. If you've got 2 and 3, that's still good, as long as you've got combination between 1, 2, and 3. Now, if you've got number 4, which is disorganized behavior, you need either 1, 2, or 3. I'm saying if you've got only 2 symptoms. If you've got only 5, for instance, if you've got 5, then you must have 3, 2, or 1. So, and this is what has been emphasized in DSM-5, that brief psychotic disorder, schizophrenia form, you need to have 1 or 2 or 3. So you can't have 4 and 5 and diagnose schizophrenia, for instance, now as we are talking. So if you are going to have 4, you must either have a 3 or 2 or a 1. Or if you're going to have negative symptoms, you must have them combined with either delusions or hallucinations or disorganized speech. That's what this means, that the minimum symptoms to have, yes, we can have 5 symptoms, yes, you can have 4, yes, you can have 3, but the minimum is 2. And out of that 2, at least one of those symptoms should either be a delusion or a hallucination or disorganized speech. These are very important, guys. These are the things that differentiate psychotic disorders, because the symptoms are the same. I'm going to keep saying this. The symptoms are the same. If you know these symptoms, these 4 symptom domains, you know already 60% of psychotic disorders. Now, the next thing that you need to go and check now to come up with the diagnosis is the specifics, the small things. Okay. So that's what we're saying. You need a minimum of 2 symptoms, and one of those symptoms must either be a delusion, a hallucination, or a disorganized speech. Criterion B states that criterion A, if you wanna sort of like memorize it, it's about the symptoms. How many symptoms do you need, and how should they be combined? Number 2 is about the duration of the symptoms. So as we all know that schizophrenia is when you've got these symptoms and now you are at 6 months or you have passed 6 months. And we know that if you have got these symptoms but it's less than 6 months, then you're going to think about schizophrenia. But something that is also very interesting, something that is also a very big difference between schizophrenia and schizophrenia is functionality. As we discussed the other day, that with schizophrenia, the first difference between schizophrenia and schizophrenia is that in schizophrenia, your symptoms should be a month and less than 6 months. That's number 1. Number 2, you don't have to have a reduction in functionality. But in schizophrenia, you must have a reduction in functionality. That functionality can be academics if you are a student. It can be work if you are someone who's working, interpersonal relationships, self-care, or some people say self-neglect, reduction. So you must have a reduction in functionality, interpersonal relationships, ne? So, but in schizophrenia, you don't need this. That's another major difference between schizophrenia. So the difference between schizophrenia and schizophrenia, it's not only about the duration. This is another big difference. And also the difference between, and also the number of symptoms that you need. But let's continue. So that's criterion C. Now let's talk about criterion. I think there is also an E as well. Okay, so let's talk about criterion D. As we all know that for us to say this is, for instance, schizophrenia, the symptoms must not be better explained by any psychotic disorder. First. And secondly, it must not be explained by any other psychiatric disorder with psychotic features. Like, if these symptoms can be explained by someone who's got MDD with psychotic features, then it's not schizophrenia. If these symptoms can be explained by someone who's got bipolar mood disorder with psychotic features, then it's not. The list just goes on. If these symptoms can be explained by some kind of anxiety disorder with psychotic features, then it's not schizophrenia. So basically, these can also be used as differentials for someone who's psychotic. I mean, when they ask you what are the differentials for someone who's What are the differentials for someone who's psychotic? There are so many, guys. There are so many. You can start with the psychotic disorders and list them, and then go on to conditions that are not psychotic disorders but that have got psychotic features. For instance, major depressive disorder with psychotic features, bipolar mood disorder with psychotic features, anxiety, whatever anxiety disorder with psychotic features, just like that with psychotic features. So then your differential for psychosis becomes very long, and you can get good marks there. And another thing is that these symptoms must also not be due to, as we all know, it must not be due to substance. Otherwise, if it was due to a substance, then it would be that substance with psychotic, like for instance, cannabis use, or cannabis induced psychotic disorder. Or my our seniors, as I'm in psychiatry now, they don't like this thing of saying substance use disorder or psychosis secondary to substance. They don't like that. They want you to say what is the substance that the patient is using. Obviously, without history and without urine tox, you cannot know. Yeah, and so there are times where you won't know, but so if you have, basically what they are trying to emphasize is that if you've got urine that says there's cannabis, then write cannabis. If it's there's methadone, then write methadone. So that's what they're encouraging us to do, which is a good thing, because substance is like very broad. So these symptoms must not be due to a substance. They must not be due to some kind of medication. These symptoms must also not be due to another medical condition, right? So just want to check now. Yeah, guys. So I just want to check if I'm leaving something behind. Okay. One thing that I think I must also emphasize is this. Yes, we have spoken about negative symptoms, guys. We have spoken about negative symptoms, the 5 A's. We've spoken about them. If we have not, please go and look at that video where we speak about signs and symptoms of psychiatry. I've explained that the 5 A's. So, what I wanted to say is, in this 6 months, it doesn't. When we say that a patient who's got symptoms of psychosis, we can only think about schizophrenia when the symptoms have been there for 6 months. So what I want to say is, the patient doesn't have to have those symptoms for the full 6 months. They can have active symptoms like your delusions, your hallucinations, except this. They can have that for 1 month if not treated, but if treated, it's okay if they have those symptoms for less than a month, right? Because there's gonna be, so with schizophrenia, apparently there are times when the patient is these symptoms are gonna be more dominant, or there's gonna be times when the negative symptoms are the ones that are more dominant in their clinical picture. So be mindful of that, guys, that you don't need the patient to be having delusions or hallucinations for 6 months. There can be a period whereby they are not there anymore, but there are other psychotic symptoms, maybe negative symptoms. And negative symptoms, guys, are not necessarily for psychosis, but for schizophrenia they are put there. You can have negative symptoms in other conditions as well, like anhedonia is there in MDD. Even asexuality is also there in MDD. Even elogia is there in MDD as well. depending the extremes. So guys, I think we are done with schizophrenia. If I remember something, I'll either make another video or I'll just put it as a comment. So yeah guys, that's schizophrenia. Thank you so much.